Hi, my name is Kai, and today we will be talking about self-harm. So, self-harm is a way of dealing with stress or emotional pain or problems. For some people, hurting yourself makes them feel better about what they may be going through. Some emotional problems or feelings that can lead to self-harm include sadness, emptiness, guilt, rage, or even self-loathing. Some common ways of self-harm include cutting or scratching your skin, burning yourself, hitting yourself or harming yourself, like slamming your head against the wall or a door or something, punching walls, hurting your body, or even swallowing substances such as pills. If you believe someone you know is self-harming, some signs you can look for are unexplained wounds, blood stains, finding sharp objects lying around near them, always covering up, they're always covering up their skin or anything. They want to be alone for long periods of time, or like isolation. And now Jilene and Michelle will talk about biological and social factors of self-harm.
Hi, I'm Michelle.
And I'm Jilene.
And I'm going to be talking to you today about social aspects.
And I'll be talking to you about the biological factors.
So when someone finds out that someone they know self-harms, they'll have several emotions going through them. One of them could be upset because they won't understand on why someone would do it to them. Another one could be responsible because they want to make sure that the person doesn't do it, and they want to try and do everything they can to make them happy. But they could also feel guilty, like if your parents found out, they'd just be questioning, like, why would you do that? What did I do to have you self-harm? And they'll think that they failed you in some way. And some people, they'll just end up feeling uncomfortable or reluctant to talk about it because they just don't know what to do. They don't know what to say or think. And they think that if they talk to you about it, that you'll just have all the emotions again and you might just self-harm. But some people, sadly, will get angry because they'll just be thinking, because they will understand, because it's easier for them to cope with their emotions, and some people just don't do it like that. They have to vent out in some way, and some people find that through self-harm. And some people even feel helpless because they're scared that it could get out of control and eventually lead to suicide. But they don't understand that it's actually like a hard habit to break. It can be addictive.
So like Kai said in the beginning, self-harm may take on different forms, with cutting being one of the most common ones. And you could actually look at self-injury two different ways. There's non-suicidal self-injury, NSSI, and it's repetitive, intentional, direct injury of one's body tissue without suicidal intent. And then there's deliberate self-harm, DSM, which is self-harming behaviors including suicidal intent. These two may be a cause of something called borderline personality disorder, which is a mental disorder marked by emotional instability and severely distorted self-image. Therapy and medications may be often provided, but if symptoms worsen, then hospitalization is often a result. Causes of BPD include genetics, neurotransmitters, neurology, and environmental factors. For genetics, adolescents may inherit aggressive behaviors and emotional instability from their parents. Neurotransmitters are mainly serotonin. Altered serotonin can be linked to depression, aggression, and difficulty with controlling sudden urges. Then there's neurology, which mainly focuses on the brain, and doctors may use MRIs to study brain waves. MRIs often found that individuals with borderline personality disorder had 3 areas of the brain that were either smaller than expected or had unusual levels of activity. Environmental factors are common and widespread among people with borderline personality disorder, and some include being a victim of emotional, physical, or sexual abuse, exposed to chronic fear or distress as a child, neglected by one or more parents, or growing up with a relative who may have a mental disorder or a drug or drinking abuse problem. Many individuals self-harm without being diagnosed with borderline personality disorder, and self-harm can be a result of stressful situations, of course. Psychological causes include, of course, borderline personality disorder, hearing voices that tell the individual to self-harm, and self-harming without even realizing that they're doing it. Self-harm is highly linked to depression and anxiety, which is widespread among many people. And borderline personality disorder includes overwhelming feelings of anxiety, anger, distress, and worthlessness. And there's 2 different forms of borderline personality disorder. There's neurosis, which is someone who is mentally distressed but can still tell the difference between their perception and reality. And then there's psychosis, which is someone who is mentally distressed but cannot tell the difference between their perception and reality and may experience delusions or hallucinations. And next we will have Thomas talking about life after self-harm and concluding this video.
Hello, my name is Thomas Massey, and I will be talking to you about the after effects of self-harm and wrapping up our video. So, you've heard a lot about self-harm and that there's multiple types of self-harm and the different factors that are involved with it. And I just want to basically reiterate those facts and continue from there. So a lot of people do not think about what would happen after they do the act. And I looked up on the internet on a lot of personal accounts that had said basically beforehand they were feeling very depressed and down about themselves, and during the act they felt much better. And then afterwards they realized what they'd done and they ended up feeling worse than they'd had in the first place. So self-harm isn't really a solution, it's like a spur of the moment sort of relief. And oftentimes people don't really think about how it will affect them in years to come. Depending on what type of self-harm the person has done, there can be scars, there can be broken bones, there can be all sorts of different problems associated with what they have done. On top of what effects that you might have from self-harm on yourself, there's also the effects on your family and friends and those that know you personally. And although you may think, well, I don't really care what happens to myself, you have to realize that these people care about you a lot, and what you do to yourself directly affects them. And whether, well, obviously any kind of harm isn't good, but the severity varies as well. So if you do really bad things to yourself, people are going to, they're going to be hurting on the inside just as much as you are, if not more. And you have to take other people's feelings into account. And in the end, you end up feeling worse than you had in the first place, and not in most situations. And it may end up leading you to doing things that you will regret further. For example, there's always a possibility of relapse to going back into self-harm after the fact, or you might end up attempting suicide or something worse, like actually committing suicide from there. But so long story short, if you feel like you are suffering from any urge and the world is just bearing down on you and you feeling depressed and you think that you have to bottle this up in some way, such as self-harm, don't keep it bottled up. Vent to somebody, talk to somebody. It does help, and it's not helping anybody, definitely not yourself, by keeping it inside. If you would like more information about self-harm or other social issues, please check out our blog that is linked in the description below.